Hi, my name is Denny Hansen, and this is my healthcare process improvement analysis project for process improvement evaluation class. This project is an allergy immunotherapy process. It is a quality improvement project. It will be a project that will address issues with the current process in injection allergy immunotherapy. Allergic rhinitis is one of the most prevalent diseases in the world. Worldwide prevalence is as high as 63%. This prevalence is obviously very ever changing based on the environment the patient lives in, different parts of the country and of the world. Different allergens based on persons, many outside, some inside, dust mites, dogs, cats, other animals, pollens, grasses, weeds, molds, even foods have the ability to have treatment by injection therapy. Allergy immunotherapy itself is a viable cure for allergic rhinitis, but is limited by the lack of adherence to therapy. The cure for it, allergic rhinitis, is there in the injection therapy as well as in drops and newer sublingual tablets. But injection therapy has been the long base treatment for this. It's been around for many years and is very successful. The problem is patients do not stick to the treatments. Less than 58% complete 3 years of the immunotherapy, with many studies showing as low as 11% completion rate. That is for skit therapy, and slit therapy, which is the drops under the tongue, is even worse. The problems is immunotherapy takes 3 to 5 years to complete based on the patient. Some patients will have one shot a year for a year and a half to 2 years. If they have asthma, you have to lengthen that so it can take even longer. And then once you get to that year and a half, 2 years where you're getting to concentration, you have to then complete that concentration round and then spread out to every other week for a amount of time and then go to every other month. And this can take as long as 5 years. Um, Multiple barriers exist for this, even other than the time of completion. Cost is a problem. The injections are typically covered by most insurances, while the drops are not covered by any insurance, and the newer tablets are covered by very few insurances. And even then, trying to get those insurances that claim they cover them to cover them is another problem all in itself. Um, Commuting to clinics is another issue. You have to come in for your shot once a week for most of the therapy, and you have to try and keep it within 5 to 10 days from your last shot, which becomes a issue when patients are traveling, because anytime you miss and get off of it, it's usually fourfold. You miss a week, you're usually a month behind. You miss a month, you're 4 months behind, if not even more. And then wait times in the office are a huge barrier. You know, if 3, 4, 5 patients come in all at once while there's already a full waiting room, nurses, CNAs, MAs are already behind. Then patients have to wait for the nurses to be able to get their shots and get to them, and then you have to wait 20 minutes after. The organization that this project will be implemented in is a ear, nose, and throat and allergy clinic in North Georgia in Blairsville, to be specific. It started out in 1995 in Canton, and then went from there to Jasper, went to Blue Ridge, and then Blairsville about 5 years ago. Since then, the company has grown to caring for patients in all four of these clinics, plus surgeries in 4 hospitals. This includes 2 surgeons, 4 nurse practitioners, 4 radiologists, and many medical assistants and other clerical staff. Conditions treated are head, neck, and skin cancer, sinusitis, allergies, thyroid, parathyroid, nasal polyps, and even hearing loss with hearing aids, and other issues such as acoustic neuromas and cholesteatomas, and surgeries to correct those, along with many other problems as well. The clinics altogether serve over 25,000 patients a year, and including thousands of surgeries as well in the OR and in the office. The purpose of this project will be to increase patient satisfaction in the process of allergy immunotherapy to increase adherence to treatment therapy. Much of the research has shown the barriers are almost always including wait times, that patients have to be um, in the office, not only waiting for the shot, but the time after, as being one of the issues with not completing therapy. So the clinical question is, in allergy immunotherapy patients, will implementing a basic scheduling website available through a text link increase patient satisfaction in the immunotherapy process? So this intervention is very basic. The patients already are hooked up to a text messaging service from the clinic so that they get updates if the clinic's going to be closed, say for lunch or sickness or something like that. And so they will receive a text if they voluntarily want to be part of the project. They'll receive a text that has a link to it, and then they can actually schedule a specific time. This can be done all the way up until the time of it. It can be done the day before and then can be changed. It'll be very, very flexible, and they're able to pick a certain time to try and decrease so many patients coming in at once. Patients that don't want to be involved in the project will still come in as they normally do, so there's still a possibility of multiple patients at once, even during the project. But even if you take a time where 4 patients came in and you drop that down to 2, it cuts down on the waiting time. So this just keeps multiple patients from arriving for injections at the same time. Guidelines that are used for this are for allergy immunotherapy are all brought from the American Academy of Allergy, Asthma, and Immunology, and are have been updated since 2011, and the site has been updated in 2023. The evaluation plan for this project includes using pre and post surveys that will be used to evaluate the patient's satisfaction with the new process. Goals and measurements will be to increase patient satisfaction scores on survey by 25%, and the project will be implemented over a 12-week period. The survey itself is a quality of patient visit survey that has specific sections, not only on patient satisfaction, but wait times. So it seems to be a perfect pre and post survey for this project. The model or framework using is the Lean Six Sigma. So the Lean Six Sigma's goal is to decrease waste overall, and one of the critical areas in healthcare that they talk about decreasing waste is in wait times, especially obviously in the ER is huge, is where this has been used plenty, but it's been used in other clinics as well. And so the theory of decreasing weight applies to this project and reducing wait times to improve success in allergy immunotherapy treatment due to patients being more satisfied. Criteria will be for patients that are not minors, so 18 and older will be involved. However, even when we do shots for minors in the clinic, they will not be involved in this project. Data collection for this project will be very simple. There'll be no patient demographics collected and no minors will be included. The data collected plan will be that patients have, if they decide they want to voluntarily be a part of it, they will be able to scan a QR code on their phone that brings up a simple survey so they can complete this obviously in pre and post, but while they're waiting in the waiting room during their 20-minute period. So it's a perfect time for them to do this. So you'll be able to scan it, it'll bring it up, and it'll automatically go into the survey database. This is then accessed by a computer that's password protected, fingerprint protected, and then on only one computer accessed by myself. Data analysis can be done through the SPSS service, be used for data collection and analysis, with the 2-sample t-test for the pre and post analysis of the quality of patient visit questionnaire. Thank you for watching this presentation, and the references will come on the following slide.